Hey, how are you? I'm Heather Flexer. Welcome to the Better Wounds podcast. I am a wound care specialist, and I basically spend most of my time talking to those of you who have had plastic surgery and you have some sort of wound issue after it, and you're my people. I want to help you get better faster. Sometimes it's hard, especially if you're having surgery out of the area and you're coming back and social media is a wild place, right? There's all sorts of groups and all this information floating around, but how do you make sense of what's out there and what's right for you? So that's what I try to spend my time doing, is making sure you get good quality wound care advice and can heal as fast as possible. Today, what I want to discuss is something I'm not an expert in, but I do deal with quite a bit, and that is compression garments. A lot of times, if someone has a wound, you're getting a lot of conflicting advice, like, should you wear your faja? Should you leave it off? What do I do? I'm not sure. What's the right garment? There are like a bajillion garments out there, just almost as many as there is wound care supplies. So no wonder you're all, confusing. There's all this advice out there. So one thing I really want to touch on is it's super important that you do wear your compression garments. They are specialized garments. You're going to use different garments at different times. Right after your surgery, you're going to be in that post-surgical garment that the doc puts you in. They send you home, right? And you may or may not get a really good look at your body until a day or two later when you go back to the doctor. So you're going to leave that garment on, just follow the instructions, avoid like trying to take a peek if they told you not to, and leave the dressings, leave the garment on, just do what you were told to do. Then after a period of time, usually a week or two, the swelling's hopefully gone down a bit and you can get into something a little bit tighter. And this is sometimes where I see a little bit of issue, and this is where like the confusion comes in, because you can get all these different garments online. Someone will tell you to do one thing, another person will do another thing. Everybody's body is a little bit different, and what's going to fit you really well is probably not going to be the exact same thing that someone else used. So you are probably going to experiment with different garments. As you progress through the healing process, you are going to need to size down. So this is just part of the additional cost of having surgery. Um, it's just one of those things. You're going to have to buy new garments along the way. You're going to try something. Everyone's going to love a garment and you're going to absolutely hate it. Whatever, it's totally fine. The point of it is you do want to wear the garment. The garment helps to reduce your overall swelling. If you think about how water runs downhill, swelling just finds a way, right? It's going to go in between the cells. So in between each cell, if they're like more round cells, there's extra space in between. And it's just going to fill up that extra space, that extracellular space with this fluid that's going to leak from the cells. It may be some in the early beginning part of surgery, part of recovery. It may be more of the tumescent fluid that they used with the liposuction. It may be like the fluid from surgery initially, but then after that, it's part of the healing process. So part of your healing process, your body brings fluid to the area to try, especially if you have a wound, it's going to swell a little bit in that area. There's going to be leaking and stuff like that. So there's a lot of fluid balance. Compression helps to limit how big you're going to get, because your skin can stretch quite a bit. So the compression kind of holds it all in. It's also going to help improve your circulation. It's going to help even with the wound healing, because the compression garment's going to limit how far that skin can stretch, and it's going to limit the ability of that incision to separate also if there's an issue there. So wearing compression is good. It's also going to help with your overall shape. afterwards, so you can kind of mold your shape a little bit by wearing compression. So in terms of wound healing, sometimes you'll hear, do I leave it on? Do I leave it off? There is a little bit of like, you're going to have to experiment a little bit. You do want to wear a garment because it's going to help limit how much fluid is there. It's going to help limit the risk of hematomas or seromas and fluid collection in a hematoma if you have developed one. Adding pressure and compression to it will limit how much it can expand, so that's a good thing. It also helps keep the incision stable, like we talked about, so making sure that you're wearing the garment is good. It even helps with scars down the line. If you're someone that has keloids in your past or hypertrophic scarring, it's an overgrowth of cells, so they're like just producing more and more cells. Having something on top like compression and even extra compression with using foams and other garments to help limit the amount of overgrowth that's possible. That is a treatment for keloids. So wearing a compression garment is also going to help the scarring overall. So don't be afraid of wearing that. Just peeking at my notes quick. One of the big things, of course, with wearing a compression is the fitting. So we want to make sure that it's tight and that's, it's restrictive, but you can breathe. We want to make sure we're not getting kind of, it's got to be the right size, and everybody's torso is a little bit different. So you want to make sure, especially if there's any, the clasps and things like that, where it is tight and where there's, it joins up with the waist, the hips come into the waist, that you're not having these really hard digging in lines. That's where like faja burns and things like that can come in. I believe I talked about that another time, but if you're having any issues with faja burns, usually if it's a faja burn or a lipo burn, if you take the faja off for a little bit and the lines kind of go away, that rubbing kind of goes away, then it's coming from the faja. So make sure you get your garment fitted. Hopefully you're working with a post-op specialist and they can at least help you measure so you know what garment you should be in. I've had some funny experiences along the way with people in their garments, but one of the funniest ones were like the open crotch garment, which definitely makes more sense for using the bathroom and all that kind of thing. But like we said, the water runs downhill. If you have the open crotch, like your kitty cat can get quite swollen because that's the only area that doesn't have any compression. So she was super uncomfortable and I'm like, well, show me your garment. And so we went with more of the garment that had the crotch that folded over, and that was a lot more comfortable for her. The other thing I think people need to be careful of, especially if you've had a tummy tuck, is using a waist trainer and only a waist trainer. I feel like that puts a lot of pressure and restriction like right at the area where your incision is. It's also going to cause a lot of rubbing right where your incision is. And I have not seen great things with that. It's almost like putting a tourniquet right around the area where you need the most blood flows. Most often I see people out there in the post-op space recommending a full faja, and it makes the most sense to me. Like you're going to swell all over and your legs potentially are going to get quite swollen. And at least if you have a garment that has the longer legs, you're preventing that fluid and that swelling from creeping in down lower. So I like a full garment. I'll recommend those. Sometimes as you're progressing through healing, you might use the waist trainer, but you're going to use it on top of the faja. And you're absolutely going to consider at some point you're going to have to use foam inserts. So the foam is just an added bit of compression, and that can really help, especially if your faja is like digging in, that can help with smoothing that area. They've got the ab boards, they've got the back boards. The back boards I think are great because you're limiting, like right in that space in the back, you have very little like the crux of your back where your back meets your tush. You have very little lymphatic vessels And it's like an open space, and water just loves going to an open space. So you might find like your back is really swollen. You might find like the back of your knees are really swollen. And these are just like open spaces where water can or fluid can accumulate. So adding the pressure, especially in the back, can help prevent that swelling back there. And then, around the front as well. Now, a lot of times you'll see there's the flat, smooth foam. It's easily compressible in there, which is totally fine. And then you'll see other ones that are more nubby, like they have little bumps on the foam. Those are great if you're having swelling that's harder, it's more indurated, you're having more of those fibrotic changes, or maybe you're worried about that. That's when you would use that bumpy textured foam. And even if you're someone that has lymphedema or lipedema, those textured foams can really be beneficial to you. And I would say, let's find you a certified lymphedema therapist that can really help guide you with that. If you're not working with anyone, feel free to message. I'll tap my network and see if we can find you someone. But there are so many people out there that have a lot of knowledge about dealing with those issues, and it'd be great for you to find a specialist for that as well. So one of the rules with wounds, and this is going to take into consideration with your garment and even with the foams, is there's a rule in wound care that we do not do donuts in wound care. So we're not going to like cut a hole. Let's see. We're not going to cut a hole in our garment where the wound is in the center. And we're not going to do that with our foams that we're using. We want even compression. So even if there's a wound, we still want even compression and an even garment. If you cut a donut in a garment or a hole, what you're actually doing is creating a space where more fluid is going to accumulate. It actually limits the amount of fluid that can come in. It actually kind of gets stuck in that hole. So you're probably going to have, if you do cut a donut, you're going to have more swelling, you're going to have more drainage, and probably slow down the healing process. So whatever you do, no donuts in wound care. So that could be a open wound, that could be an area that's like a darker, scabby looking area, that can just be like this weird area that's leaking more fluid on your incision line. Those are all like indications that something else is going on underneath there. And we just want to kind of do the uniform compression. You may have to change the garment more often. You may need to like take a break from it. Maybe you can't do 24/7. Maybe you got to take a break at some point. It's not a bad idea to get eyes on an area that's of concern and isn't totally telling you what's going on yet. That's something that we do. I know it's frustrating for you out there when you're like, would someone just tell me what to do exactly? And unfortunately, some of this stuff is like, well, let's try this and see how your body responds. It's not the worst advice you've ever heard. It's just not the advice that you want to receive. How do we know if your garment is too tight? If you have a wound, the wound is going to look darker. It's going to look gray. It's going to potentially get bigger. The surrounding area may look not as healthy pink like the rest of your skin. Like there's just not enough blood flow, essentially. You want to make sure that your incision is healed, you don't have any wounds, things are closed before you start going extra tight. I know there are, the stage 3 garments and things where you're going like super tight to really conform your shape. That's okay, but you probably are going to wait until you're in the clear as far as healing. So that may not be until week 8, week 10, week 12. It just depends on how the early healing has gone for you. So some of it will be a wait and see. Some of it's going to be, we're going to start here and we're going to slowly evolve what we're doing. You're probably going to experiment with other garments. You're definitely going to have to size down. When your garment starts feeling loose, but you're not ready for that size down, that's a great time to add in more foams. make sure you're doing all your lymphatic work, getting your post-op care massages, doing all the things, getting your nutrition, walking around, getting moving again. By week 12, you should be nearing back to your original level of activity. You should be back to work, all this stuff. So the garment can also help you feel more secure so that you can go and do these other things. So wearing garments, it's a plus. Make sure you're doing it. And if you need anything as far as like you have an open wound, you're not sure what you're looking at, you're not sure if it's lipo burn, faja burn, I have no idea what's going on, I need some help, that's exactly what I'm here to do for you. So go ahead and reach out wherever you're seeing this. You can shoot me a message. You can also find me on YouTube, Instagram, or message me directly at betterwounds.com. If you feel like you need support, just go right ahead and hit that shop button on betterwounds.com, and you'll see the first thing that pops up is a virtual consult. You can use code podcast for a discount, and I'd love to be able to help you. So go ahead and reach out, shoot me some pictures, let me know what's going on. If you found this useful, helpful, leave me a little 5-star review so I can get some people to come and join me on this ride over here. So I hope you're good. If you're not, you know how to get me. Talk to you soon.